I'm David Adams. It's my great pleasure to welcome you to the 5th ATS Mitral Conclave.
Hi, I'm Dr. Randy Martin, and I'm joined by Dr. Pedro del Nido. Pedro, as all of you know, is past president of the ATS and been a tremendous innovator in the field. So Pedro, cardiac surgeons have really developed technology, valves and all that, and I think they've made a lot of advances in the field. But in your world, in pediatric cardiac surgery, it's kind of hard to have adult technology transferred to your world. Tell me a little bit about that.
Exactly. I think that's been the big challenge. And the fact is that industry doesn't have any incentive to do it, to solve these problems. Why? Because the market is small, and there's a specific bigger challenge, which is the growth.
Right.
How do we address that? Well, that's where I think our responsibilities are as cardiac surgeons. We understand the problem, we know what we need, and I think when we partner with very clever engineers, we can actually come up with designs that address those problems. Once we develop them, once we prove the concept, then I think it's a lot easier for industry to come in and actually get it out into the clinical world. And we need the industry to support that, because they know how to do that. They know how to go through the regulatory process, how to build things, but we don't know that. But we can solve a lot of the technological problems and provide a solution that's kind of ready-made, ready to go. And that's, I think, our responsibility.
That's not only in pediatric, but in the full gamut.
In the adult world.
And you know, you've been a tremendous innovator all your life. You really have. A compliment you. I had the pleasure of hearing your history when we were together in Shanghai. But how do you encourage the cardiac surgeon or the surgical expert to do that, to innovate? I mean, you know, it's because it's really how it's all come.
Yeah, some of it is innate. I mean, someone has to have that desire, okay, and then you work with that. If all you want to do is what you do every day and not have to worry about these things, then that's fine. That's that's a perfectly good thing to do. But if you have that itch, if you have that drive, then you work with that individual, and then you need to, like anything else, you need to understand what people are doing, what works, what doesn't work, and then the rest of it is just connecting with other smart people and hard work. It's not that complicated. We can do it, and we've done it.
You make it sound easy, but the objective is really to make the therapy better, or take care of people better, not to have a startup company and have somebody acquire it for $8 billion.
Yeah, that's what everybody talks about. But on the other hand, at the end of the day, though, it's real solutions are the ones that are worth the $8 billion. The solutions that are knockoffs that don't really work, they never go anywhere. I mean, people, at the end of the day, you start using it clinically, it doesn't work, it never goes anywhere. So, no, you want to find the real solution, something that actually will solve an unmet need, and then it has a life of its own after that.
Where do you see innovation in the field of cardiovascular therapies, surgery, changing the way that we practice and the way that patients are treated in the future? That's a complex question, but how do you see it?
We're hearing it now at this very meeting, right? I mean, it's less invasive, less open chest, less open heart, less bypass. There's no question that we need to advance in that area, and particularly because we're not just treating the 45-year-old healthy, we're treating the 85-year-old who's got many comorbidities, and they still deserve a shot. So how do we get them through the surgery? This is where the innovation comes in, and I think we're hearing so much of it today at this meeting, and this is just in the mitral world. Same thing in the aortic world, same thing in congenital.
Right.
Yep.
Does the Society of the ATS, which has done a tremendous job in education, in other words, have you all established a mentorship program, or do you have it? I'm just thinking, listening to you talking about people who have an idea, they want to do this or that. Is there that concept that they could call up and say, I need to talk to Pedro because he's done this or that? But does that exist?
Well, so formally there is an innovation program as part of the AATS annual meeting, and there you will listen to people who've done it.
Right.
You know, they don't just talk about it; they have actually done it. They've actually done it. They know how to do it, and I would encourage people to go there first, and that's where you actually see. You know, you encounter the problems that you're going to face if you're going to innovate, and also you can talk to friends, because no one knows the entire landscape. No one knows from A to Z what to do, but the collective wisdom is what you need in order to get your technology through, you know, the myriad of hurdles.
Right.
And that's where that plays. So the AATS has responded. The innovation program, I think, is a fabulous program,
Yes.
and it will, you know, the more interest, the more it'll expand.
You made the interesting point that you've got to work with industry. I mean, it's, you know, the whole conflict of interest thing is really disruptive to some extent. I mean, some of the early advances we did at Echo were really working closely with super engineers who are
Absolutely.
smart. Let me ask you in closing, you're a tremendous expert and known entity in pediatric cardiac surgery.
Mm-hmm.
Where is that field going? I mean, obviously dealing with the adult with congenital heart disease who's had prior surgery, but where is your field going?
So there are two big challenges. Number one is the children with really complex problems where they're missing a heart chamber.
Right.
That we're just trying to get them longevity in
Right.
life. And that's still an ongoing challenge. And then the other one is where children have fundamentally a heart that's fixable, but we're not just planning for the next 5 years, we're planning for the next 70 years. That's where our field is going. What do we put in, what do we do that actually gives us 15, 20, 30 years of good quality life, as opposed to just, we're going to fix the problem today so your symptoms go away, but we're creating another problem down the road, and which is a lot of what used to happen. I think that's the big change in our field.
Good. Well, listen, I applaud your innovation and then your excellence in cardiac surgery. Thanks
Thank
for
you.
joining me.
My
That's
pleasure.
great.
My
And
pleasure.
thank you for joining us.